Hi, this is Helena Williams for NR302, and this is my return demonstration for the head to chest. I want to start with the room sweep first. Okay, so I'm just going to go ahead and introduce myself to my patient.
Come here.
Hi, my name is Helena. I'm going to be your nurse today. How are you?
Hello, I'm well.
Okay, is it okay if I do a short assessment on you?
Sure.
Okay, so it's just going to be 15 minutes and it's head to chest. So
Okay.
they won't take very long. Can I start by getting your name and date of birth?
Sure. Melina Williams, January 12th, 1973.
Okay, and do you have any allergies?
No. Oh, yes, I do. I'm sorry. I am allergic to penicillin.
Okay. And so then I'm just gonna, excuse me, I'm gonna move on to general appearance. The patient is sitting upright. She appears comfortable, and her facial expression matches her stated mood. She is her skin color is consistent with her age and ethnicity and genetic background. I don't see any assistive devices, and I don't see her struggling or gritting. Her posture is relaxed, not rigid. And so I'm just going to move on to her skin and nails. So is it okay if I take a look at your hands? Okay. So her skin is consistent with her color is consistent with her age and genetic background. Her nails are smooth, rounded, concave, and profile sign is approximately 160 degrees. And then if I just press on them, capillary refill is less than 2 seconds. I'm going to go ahead and let you drop that hand. And so then I'm just going to give this tiny little pinch. Okay, skin trigger is good with elastic recoil, no evidence of tenting. You can go ahead and drop that hand, and then I'm just going to feel with the back of my hands. Her skin is warm and smooth. And so then moving on to your head and your face. Her head is normal cephalic. Her hair is evenly distributed on her head. No visible signs of bumps, bruises, or lesions. Is it okay if I feel your head?
Sure.
Okay. Does this hurt at all?
No.
Okay. And then, so, yeah, no palpable lesions, bruises, or sores. Her hair is evenly distributed on her head. And the texture and consistency is also consistent with her background. Excuse me. Moving on to her face, her facial expression matches her reported mood. So I'm going to go ahead and move on to lymph nodes. Okay. Preauricular, postauricular, occipital, submental, submandibular, superficial cervical, jugular-digastric, superficial cervical, deep cervical chain, posterior cervical, and then can you go ahead and shrug your shoulders a little bit, and then supraclavicular. So none of her lymph nodes are palpable, which is a normal finding in an adult female. And so I'm going to go ahead and move on to her eyes. First thing I noticed about her eyes is that they are symmetrical. The outer canthus of the eye lines up at the top of the ear. Her eyebrows and her eyelashes are also symmetrical. Eyelashes curl up in a way and downward in a way. So is it okay if I just pull your eye down just a little bit? Can you look up? Conjunctiva are pink. Her sclera are china white. Her irises are brown. Okay, and then I'm gonna go. You can look straight ahead. I'm gonna go ahead and shine this light in from the side. I'm using this because I don't have a pen light yet. Okay, pupils are equal, round, and reactive. Reactive to light. And then can you go ahead and look? Okay, and then accommodation is noted. And so moving on to her ears. So upon inspection, her ears appear healthy and clean. There's no signs of any drainage or swelling or exudate. She does have piercings in both her earlobes, but they appear to be completely healed. If I were to look inside the canal, I would see that there's no cerumen impaction, and it appears clean. Do you use hearing aids?
No.
Do you are you exposed to any loud environmental noises?
No.
How do you clean your ears?
Usually in the shower with warm water.
Okay. And so then I'm also noting that upon palpation, is there any pain?
No.
Okay, and I'm just going to feel on the other side as well. Okay, and I'm also noting that there's no dry skin behind her ear. I'm just going to make sure that it's the same on the other side. Okay, and so then I'm just going to move on to your nose. Her nose is medial and proportionate with the rest of her face. So go ahead and look up just a little bit. Okay, so there's no drainage or blockage, and there's no septal deviation. Can you go ahead and plug one nostril and breathe? Can you plug the other and breathe? Okay, so patency is noted bilaterally. And so moving on to your mouth. Okay, your lips are pink, moist, and intact. Okay, and then can you go ahead and open your mouth? I'm just gonna look inside. Buccal mucosa are pink, moist, and intact. Hard and soft palate are pink, moist, and intact. The hard palate has a yellowish tinge, and the soft palate has a grayish tinge. Teeth are china white and straight and aligned. Tongue is also pink, moist, and intact. Can you go ahead and stick your tongue out and say ah? Okay, uvula rises with pronation, which means that cranial nerves 9 and 10 are intact. So moving on to respiratory. I'm just gonna start off like everything else with inspection. So patient is sitting forward facing me. She appears comfortable, no use of accessory muscles. Her costal angle is 90 degrees, and her transverse diameter is twice the size of the anterior posterior diameter. And so I'm going to go ahead and feel the front first, and then the back. Is it okay if I feel the front?
Yes.
Okay, and then I'm just going to move to the back. Is there any pain?
No.
Any pain when I do this?
No.
Okay, and so first I'm just going to place my hands at T9 and T10. Can you take a deep breath for me? Okay, so chest expands symmetrically. And then I'm going to place my hand on your back, and whenever you feel my hand, can you say the number 99?
Yes.
Okay.
99. 99. 99. 99. 99. 99.
Okay, very good. Vibrations felt, even vibrations felt throughout bilaterally. Okay, so I'm going to go ahead and move on to auscultation. I'm just going to listen to your lungs. Can you take a deep breath each time you feel my stethoscope?
Yes.
And let me know if I'm going too fast or if you need to take a break.
Okay.
Right upper lobe, left upper lobe. Right upper lobe. Right upper lobe. Left upper lobe. Left lower lobe. Right lower lobe. Right lower lobe. Left lower lobe. Right lower lobe. Left lower lobe. Okay, right sounds clear and equal bilaterally. So I'm gonna go ahead and move around to the front and just listen to your lungs again. Right upper lobe. Left upper lobe. Left upper lobe. Right upper lobe. Right lower lobe. Left lower lobe. Can you raise your right arm for me? And take a deep breath. Right middle lobe. Okay, birth sounds clear and present, equal bilaterally. Okay, so I'm just gonna go ahead and move on to your heart. And I'm gonna start by observing the neck and the jugular vein in the neck. I don't see any jugular vein distension. I also don't see any carotid artery pulsations. So I'm gonna go ahead and feel your carotid artery one at a time. 2 plus regular rate and rhythm. 2 plus regular rate and rhythm. Okay, and then I'm gonna go ahead and feel your chest, make sure there's no vibrations or thrills. Okay, have you ever been told that you have a heart murmur?
No.
Okay. So I'm gonna go ahead and listen to your heart first with the diaphragm and then with my bell. So you can go ahead and breathe normally and just relax. Aortic. Pulmonic. Erb's point. Tricuspid. Can I ask you if your left breast, please? Mitral. And I would auscultate the mitral valve for a full minute. Okay, so a minute has passed. Apical impulse has a regular rate and rhythm. So I'm gonna go ahead and listen with my bell. Also, S1, S2 sounds were noted in each of the heart areas. So I'm gonna go ahead and listen with my bell. Aortic. Pulmonic. Erb's point. Tricuspid. Can I ask you to lift your left breast again? Mitral. Okay, so no S3 or S4 sounds and also no murmurs, which is a good sign. So the last thing I'm going to do for the assessment is, can you hold your wrists out like this? Is I'm going to palpate the radial pulses. Okay, both radial pulses, 2 plus equal bilaterally. Regular rate and rhythm. Are you in any pain?
No.
Okay, is there anything that I can get for you?
No.
Okay, so I'm gonna go ahead and give you the call light,
Thank you.
And if you have any questions or if you need me, just go ahead and press the call light. I'm gonna lower the bed to the lowest setting. I'm gonna place the side rails up if they are indicated. I want to thank you for your time, for allowing me to do this assessment and perform hand hygiene, and that's going to be it.